Good morning, my name is Martin Neugwou. I'm a student practical nurse. In this video, I'm going to show how to administer rectal suppository. For this purpose, I'm using bed rotation number 4, and I have the doctor's order and the PRN MA, Pro Renata MA, so as needed MA. I'm going to make sure now, let's make sure now that the information that I have on the doctor's order is correctly transcribed to the PRN MA. So the doc will start with the patient's name, Carly Patrick, date of birth May 26, 1977, patient ID 4321. On the MA, patient's name, Carly Patrick, date of birth May 26, 1977, patient ID 4321. The medication, the patient's, the doctor's order reads Dulcolax, suppository 10 milligram PR if no bowel movement for 3 days, fleet enema PR one time if suppository ineffective. On the MA, Dulcolax suppository 10 milligram PR if no bowel movement for 3 days, and fleet enema PR every 3 days if suppository ineffective. So I see that the information I have on the doctor's order and on the MA, it's correct. So I'll put the doctor's order away now. So what I'm going to do now, I'm going to see my patient. So hand hygiene, provide privacy. Pam, pam, pam. Doc, good morning. My name is Martin Neugwou, and I'll be your student nurse taking care of you. How are you today? May I have your name and your date of birth, please? And so, Carly Patrick, date of birth May 26, 1977. So I check on the wristband to make sure I have it to identify Carly Patrick, May 26, 1977. So, the reason that I came here is because the doctor ordered to administer a suppository like Dulcolax, and due to the fact that you haven't had a bowel movement for 3 days, do you have any allergy? Not that you know of. Have you had any rectal surgery in the past? Any problem with diarrhea, constant constipation? Now you obviously you're constipated, and I was going through also your vital sign here, and I can see that your blood pressure is slightly high. It's high at 145/95. I will talk to the doctor, and we will take further action regarding that. And also your body temperature is at 38.5 Celsius, which is slightly high as well. But I do see that you was given, my colleague gave you Tylenol 20 minutes ago for your temperature. So I expect your temperature to go down during the next 15 minutes, and if not, I will report that to the doctor as well. So in the meantime, you have the right to refuse the medication. But before that, I wanted to talk to you a little bit about Dulcolax. Dulcolax is a laxative, so it's to treat your constipation. You should see your bowel movement during the next 15 to 60 minutes. The allergy you may have, well, you might have some side effect when we administer that, like rectal irritation, burning, itching, and mild abdominal. But I don't I expect you to have a serious allergy problem. But in case it was to arise, things like rectal bleeding, a blister, or persistent diarrhea, let me know. We will let the doctor know as well, and we'll take the. And then, of course, you could have some more serious allergy like swelling, or swelling, itching, rashes. Of course, let me know, and then we'll take further action regarding that. So if you have the right to refuse the medication, as I mentioned, and if you're comfortable, I'm going to go now and prepare the medication, and I'll be right back. Thank you. So I'm going back now to get the medication. We prepare my medication. medication, and I'll come back and see my patient. So I have my Ma here. So I have my medication tray. So the medication is pre-made, and I have prepared also the lube. The lube, I'll put that in the tray for now. So I have the pre-made medication. So I'll start by doing my I'll do my 3 checks, 5 rights. So compare that with the Ma. So the right patient, it's Carly Patrick, May 26, 1977. Carly Patrick, May 26, 1977. The right medication is Dulcolax. The right medication is Dulcolax. The right dose is 10 milligram for adult. The right dose is 10 milligram for adult. The right route is suppository PR, so per rectum. So it's a rectal medication. So the right route PR, rectal, right medication, and then the right time and frequency. So this one can be given any time during the day, but just once a day. So because it's an as needed medication, PRN. So that completes my first check. Now I'm gonna open here. The suppository is pre-prepared. So I'll put that on my hand here. So the right patient, Carly Patrick, May 26, 1977. Carly Patrick, May 26, 1977. The right that's the right patient. The right medication, Dulcolax suppository. Dulcolax suppository. The the right dose is 10 milligram. 10 milligram. The right route is suppository PR, so PR, so with the rectal per rectum, so suppository PR, and then the right time and frequency, it's any time during the day, but it's just once a day, and it's as needed. So that's completes my second check. I'll put that in my card, and so I'll put that in my card and put this medication away. So again, I'll do the third check. The third check is the right patient, Carly Patrick, May 26, 1977. The right medication, Dulcolax. Right medication, Dulcolax. The right route is suppository PR, so per rectum suppository. The right dose is 10 milligram, so 10 milligram, that's the right dose. And then the right time and frequency, it's any time during the day, but just once a day. So and as needed, so if no bowel movement. So this complete my third check. I'll now take my medication and my PR and come back to my patient. Come. Good morning, good day, I'm back again. So I will settle my tray over here, just by on bedside, and I will check again my Ma with the 2 identifiers. So Carly Patrick, May 26, 1977. So I got the correct patient. So now I'm donning my gloves. So my first gloves, I'm donning that, and I'm gonna put my patient in the left side seam position. So with her knee and her hip slightly move towards her chest, or his chest. So for this, I have also used my box. This will be like my anus. So with my gloves, I'll try to examine and palpate the anus and make sure there is no presence of hemorrhoid, no presence of any rectal bleeding. But the patient already told me that, but I'm gonna just any malformation, any presence of hemorrhoid. So I see that everything is intact. The patient told me she never had any surgery, so I can confirm that here. So once I'm finishing, I'm removing my gloves, and I'm gonna do hand hygiene again and don gloves. This time, I'm just, for the sake of economy, I'm donning gloves just one time, but in reality will be 2 times in a hospital setting. So I'm donning my gloves. I have my medication here. So I will take the medication and just carefully open that, and I put the lubricant a little bit. I put the lubricant right, and then to my index finger as well, putting the lubricant on my index finger. Then I'm gonna remove the medication for there and apply it into the anus, and going as far as 10 centimeters into the rectum. So apply that, and you should stay in that position for 5 minutes, and during that for 5 minutes, and again you should see your bowel movement within 15 to 60 minutes. Now if the suppository doesn't work, we're going to use the phosphate enema. The phosphate enema, you should see that you should see your bowel movement within the next 5 minutes. But let's hope we don't run into that. So I'm discarding now the medication, removing my gloves. And I'm going to stay around for about 5-10 minutes. So I'll just cover that to see if there is no allergic reaction from you. And in the meantime, I'm doing my medication at the bedside. So the date of today, I'm writing the date of today, and then I'll write my initial, and then the time is 8 o'clock in the morning. Right there, I've done my medication. So I'll come back to the patient. Are we still okay? And then I'll put the bed, I'll raise the handrail and put the call light. So I'll be back in 10 minutes to see how the medication is reacting, and if you have any allergy. In the meantime, if you need something, just call me. So this concludes the administration of the rectal suppository. Thank you.